This is my maiden speech. However, I will dispense with most of the usual thank yous because I do want to have as much time possible to outline my concerns for those in my community working and living in care settings. I do want to extend my condolences to everyone who has passed away in my constituency and throughout the country. I only wish to say, though, that I do heartfully thank everybody who has supported me through all the years where I've been campaigning in Dublin West. You all know who you are, and I hope some of them are listening here this evening. Minister, I've been deeply concerned by the emails and phone calls that I've received over the past few days from parents, carers and staff of private residential care homes and private care home providers. I was contacted by a home care worker who provides support for an elderly person the previous week, and I just found out that this person had sadly passed away from the coronavirus. The elderly person was ill, but the care worker wasn't told that it was the COVID-19. He did what every caring person would do, and he phoned his manager and he asked what would he do in those circumstances because it was the beginning of the day. And he was told to go and see all his clients that he had scheduled in that day, possibly putting them at risk. I was also contacted by two parents of very vulnerable children at high risk who said that the care worker coming into the home that day had been off for 2 weeks. They didn't know it was COVID-19 at that time because they were not informed by the company nor the worker that she had COVID-19, only that she was on sick leave. And they weren't contacted by the HSE either to inform them of the situation. Again, just yesterday I spoke to a very experienced and professional residential care worker, and he said staff haven't been told that they don't have to wear PPE even though it's on site and available. New staff have been taken on with absolutely no experience whatsoever. He also stated that contrary to normal best practice, there is no shadowing with an experienced and trained member of staff, and this is leading to poor hygiene and potentially poor outcomes for residents. He also said that they've been given directions by the HSE to wear equipment one day for it to change the following day. And they're confused, and I suppose there's a lot of frustration in relation to trying to care for the residents in very difficult circumstances. In another care home, the HSE visited the centre and only spoke to the management, and he didn't consult with a single member of staff. And I think that's really important that those people are consulted and spoken to, because they're the ones who are working with people on the ground. Last week I spoke to a family member of a home care assistant, and I think it really summed it up really well. She self-isolates as best as she can between shifts because she's too tired, too angry, too furious and too upset to put into words how she's feeling. She hasn't hugged her kids in weeks and they miss her, but they're proud of her. She's risking so much more than me, more than you and more than she should have to. Minister, what can you say to these frontline workers we have, which we all clap every week, who have had many big announcements, but by the looks of them, from what I'm hearing, anecdotally from people and people directly, is that we've had poor delivery on some of those announcements. And the question I suppose I would put you is, can you confirm that they all now have PPE equipment that they need? Can you confirm that they have the staff that they and the residents need for their proper care? Can you confirm that the companies who victimise workers who speak out will be sanctioned? Can you confirm that the families availing of home care packages will feel safe in the knowledge that home care workers coming into their homes and not putting their children and elderly relatives at risk? And can you acknowledge that the private care system cannot cope with a pandemic and that we need to move into a one-tier system of care for our most vulnerable citizens?
Deputy, do you want the Minister to respond, because the clock is ticking?
Yeah, just I suppose, could I ask if any of the questions that you can't answer, would you please write them to me? Just one final one then, Minister. Could I also ask if you consider designating specialist support services for children with ASD as essential workers? Parents are under severe pressure at home with children with ASD, and they're in real difficulties.
Thank you, Deputy Donnelly. Minister.
Look, just in the interest of fairness, because I'm conscious people at home watch these, they hear questions being put out on the floor. They don't get the letter I sent to you in the post. So, I mean, we have to divide up the time here. I came here to answer questions. If I don't know the answer, I'll write to you. But we have to be able to at least have some time to answer the questions.
Very briefly,
Minister, yeah, on the issue. So, if we could divide the time properly going forward. On the issue of Jigsaw, just Deputy Ward, I'm actually due to meet them on Thursday, and I'll come back to you after that. Mental health is a key priority, particularly youth mental health, and I'll come back to you directly. We want to support Jigsaw in what they're doing. Deputy Donnelly, on the issue of ASD, I think you're right. I mean, there is a reality now that there's a lot of kids who've been out of school and maybe haven't been even able to access normal health supports either. We've got to look at what an intervention for them will look like over the summer months. I'm working on that across government. Look, I want to acknowledge the huge work done by people in home care settings and in residential care settings. I think if there is any complaint that anybody has, there are obviously regulatory authorities to go to. HICWA have started inspections and visits this week in line with standards. I think that will be important. And the issue of PPE, I've put on the record of the House the increase, Cahirlock, in that regard, and also on staffing, and I'll write to you on the rest. Thank you.